In the woven complexity of our healthcare system, there lurks an unseen force that threatens African Americans' health, the ghostly presence of racism. Can you believe it? The poison of systemic healthcare racism and medical bias is real, seeping discrimination into every corner. It's a grim battleground where racial disparities pile up like insurmountable odds against them. African Americans are climbing a steep hill in many areas, but nowhere is it as deadly as within our healthcare institutions. Envision a young black man writhing in agony. He needs help now. He stumbles into the ER only to be met with doubt when every second counts. This isn't just one sad story. It's part of an alarming trend where snap judgments override thorough exams. The price? Critical delays, wrong diagnoses, and dreams shattered prematurely. We see infant mortality soaring high above average, hearts giving out too soon, and cancer claiming more futures, all hitting hardest on African American families. Look beyond income levels and access to care. It's also about subtle racial disparities that lurk around corners, casting suspicion instead of providing aid. We've got ourselves not merely public health turmoil, but also an ethical dilemma screaming for us to step up and tackle head first. Bias in healthcare providers can wreak subtly or overtly, spreading pain and loss like wildfire. This grim shadow looms over many African Americans' lives daily. Picture those grappling with chronic illnesses, sans the support they deserve, suffering silently, and watching dreams dissipate into thin air. It's an ominous cloud darkening their fundamental human right to health care, a right that should be indisputable. We're at a tipping point. The story we tell about our society has got to flip, and fast. In this gloomy landscape shines a ray of hope. The rising awareness and conversation, piercing through the darkness, are guiding lights forward. By deepening our grasp on medical bias's harsh realities, you're joining us on a quest toward tearing down these monstrous walls, fostering health inequality, walls responsible for heart-wrenching mortality rates no one should face. Time to shine a light on something that skulked in the dark corners for way too long. Healthcare racism. It sneaks like a viper through our clinics and hospitals, an unseen specter beside every examination table. If you're black, you might know this beast all too well, the gut-wrenching sensation of being ignored or brushed aside when it hurts most. Medical bias can be sly. It doesn't always shout its presence. Maybe there's hesitation in a doctor's voice, an unfounded assumption by a nurse, tiny moments igniting huge decisions that veer care away into uncharted territory. Like ghost prescriptions never penned, diagnostics left unordered. These are steps not taken, and for black patients, they pile up into life-altering consequences. The prejudice we're up against isn't just face-to-face. It's woven into the fabric of our tools, the algorithms, guidelines, everything healthcare pros put their trust in. Can you believe that many medical instruments might not fully capture African Americans' health needs? That results in care falling short of what they deserve. Imagine battling a ghostly foe. Systems designed for healing and safety are tinged with discrimination. Healthcare workers mirror society at large. Don't we all have blind spots shaped by the world around us? Yet, when it comes to medicine, we can't afford slip-ups or cling to stereotypes. The risks are way too real. Tearing down these barriers goes beyond duty. It's about being humanely responsible. We're talking about lives hanging in balance here. It's high time we deliver equitable care, one meticulous gesture after another, free from racial disparities and health inequality. Healthcare racism packs a punch like nothing else. Think of it as a persistent infection that stubbornly defies simple cures, silently causing chaos. It's powerful, folks. It amplifies every single societal and health disparity African Americans already face. Ever imagine discrimination in healthcare? Picture this: a hydra-like monster with many heads. Some are overt choices to treat patients differently based on their skin color, while others lurk within deep-seated institutional policies driving segregated care. This beast looms over hospitals serving primarily black neighborhoods. They get less money and fewer resources. And there's also this gaping hole where black doctors should stand. Not to mention how often basic cultural understanding is missing when caring for patients. But wait, there's more. It isn't only about one person's bias. We're talking total systemic failure here. For black individuals seeking medical help, expect longer waits than anyone ought to tolerate. The clock ticks away their patience and sometimes chances at recovery. Prevention services might seem like distant dreams rather than routine checkups you'd expect. For them, advanced treatments options even more so. Coincidence doesn't play any part here. We've got ourselves an unfortunate rhythm marking time to the beats of inequity. Imagine the sting when healthcare turns its back. Not just bruised egos, but a deep-rooted mistrust takes root. Why would African Americans eagerly step forward for care, dive into medical research, or faithfully stick to treatments? Their hesitation has a backstory. It's woven from strands of painful truths and neglect by those sworn to protect their health. And there you have it. Discrimination paves the way for racial disparities that echo down family lines as if etched in DNA. Oh, how tough is this pill? In our home of liberty and justice, isn't it outrageous that skin color might dictate your access to quality health care? It's nothing less than an affront, a blotch marring our collective conscience. And my friends, we can't turn away. Health inequality lurks like a specter, undermining the American dream, and serving as a harsh reminder that not everyone is dealt an equal hand in pursuing good health. To African Americans, it's far more than just a shadow. It's an oppressive force casting its pall over their entire existence. From day one, when an African American baby draws their first breath, they face stark realities others don't. Less protection from harm and hazard at each turn. They often get handed tap water heavy with lead or air thickened by pollution, and even accessing wholesome foods can be tough because of all those food deserts out there. As these kids grow up, the hurdles stack higher still. Education, employment, housing, name any cornerstone for thriving healthily, they're thwarted left and right by medical bias woven into our social fabric itself. We're talking beyond dollars here. We've got stressors gnawing away silently beneath the skin that no bank account size will fend off on its own. Hey there, did you know health inequality isn't some abstract concept lurking in the background? Nope, it's front and center on life's stage for many African Americans. Picture this: every single healthcare choice, every doctor visit, heck, even their hopes for the future, it all unfolds within a world where one's skin color can unfairly seal their fate. So tell me, are we ready to tackle racial disparities head-on and reshape our narrative into one where discrimination in healthcare becomes history instead of someone's present reality? Let's face it, the stakes couldn't be higher when we talk about racial bias in medicine. It's literally a life or death situation. It represents the lives needlessly lost and dreams tragically snuffed out, all because someone didn't get fair treatment from those sworn to heal. Now is the time for us to step up. Healthcare powerhouses, yeah, you, hear this loud and clear. Spotting medical bias isn't enough. You've got work to do. Imagine clinics buzzing with inclusivity, where African Americans stroll in knowing they'll be treated like gold, their well-being held high on everyone's priority list. Let's harness technology's potential to ensure no biases lurk within our algorithm's code. Data must light our path forward as if it were some kind of North Star leading towards undiscovered territories where health inequality doesn't exist anymore. That mesmerizing utopia known as equitable healthcare land. Imagine healthcare pulsating with genuine empathy, where every heartbeat echoes a commitment to understanding and compassion. Picture ourselves engaging with each patient as if they're revealing an untold narrative, one uniquely theirs, rather than lumping them into categories. We must take action now. If not us, who will fight against medical bias that threatens so many? Because tackling health inequality head-on means there's no room for hesitation. Lives teeter precariously on the edge, while racial disparities in medicine cast long shadows. In our nation's rich tapestry, African Americans have too often been rendered invisible and neglected within the healthcare system. It's a sad truth, backed not by mere opinion, but solid research that paints a clear picture of racial disparities. Numerous studies reveal an uncomfortable reality where African American patients frequently get subpar treatment compared to whites, even when you level out insurance coverage and income differences. Imagine needing crucial heart care, kidney dialysis, or diabetes management only to find these services less accessible because of your race. Beyond these injustices lies a deep-rooted distrust towards medical institutions among Black folks. An emotional wound etched by historical wrongs, such as the infamous Tuskegee syphilis study. This isn't just old news. It echoes loudly today with each encounter where they're made to feel insignificant or stripped of humanity by those sworn to heal them. African American mothers face a death risk during childbirth that's 3 to 4 times higher than that faced by white women. Staggering, isn't it? And their precious babies have double the odds of not celebrating even one birthday cake. Tears shed, dreams shattered, love lost. These aren't just cold facts. These are raw human tragedies begging us to sit up and take action. Can you feel the heartache when an African American mom's pleas fall on deaf ears at her doctor's office? Think about a dad seething with helplessness as his own pain goes undertreated. Picture young lives overshadowed from birth, not because they lack potential, but due to unfair gaps in getting basic health safeguards. These narratives cut deep into our conscience. They're more than stats. They scream injustice. Each story is someone's reality, a painful testament, highlighting racial disparities we simply can't ignore anymore. Healthcare racism is an insidious beast, skulking at the crossroads of policymaking, medical practices, and deep-seated prejudice. It entraps its prey in silence. We only recognize it when harrowing mortality statistics finally demand our attention. Heart disease, stroke, cancer, these grim reapers snatch away African American lives all too frequently. These aren't mere numbers on a page. They represent real people. Fathers and mothers ripped from their loved ones much too soon by preventable causes. Black folks receive less pain relief in emergency rooms and struggle for credibility as they voice out their torment. During intense crises like these, the shade of your complexion may dictate whether you'll walk back into daylight or be trapped in shadows forevermore. Chronic illnesses don't play fair, do they? African Americans grappling with high blood pressure and diabetes embark on a treacherous journey, one that's riddled with traps laid by a healthcare system. What should be top-notch care turns into an obstacle course that just fuels their health issues. Systemic racism gnaws at your well-being. This relentless stress linked to long-term ailments for many African Americans, constant discrimination that wears down the body to its breaking point, that's allostatic load. Racial disparities in medicine aren't simply numbers. They're stories unfolding right now, with pain as pervasive as physical symptoms themselves. How many dreams have been cut short by health inequality lurking around those sterilized corners? Discrimination within healthcare screams out loud from stark statistics no one can ignore. So what do we say when faced with these harsh realities? Isn't it high time we demanded change, for equity, for justice, for all our sakes? To tear down the harmful effects of medical bias, it's essential that we face this beast directly. Imagine how deeply ingrained stereotypes and preconceived notions can taint our healthcare system, singling out African Americans and undermining their quality of care. What if I told you doctors need intense training, not your typical afternoon seminar, to spot those sneaky implicit biases? Think about creating a space where self-reflection isn't just encouraged, it's critical. and caregivers are ready with open arms for all patients, regardless of skin color. Have you ever pondered whether diagnostic methods and treatment plans really serve everyone equally? Are health tools fair across the board? Do they consider what makes African American health distinct? We've got to make sure that medicine serves its true purpose, healing, not deepening divisions due to racial disparities in healthcare outcomes. Healthcare education is in dire need of transformation. Every budding healthcare practitioner breathes the knowledge of past and ongoing injustices that sculpt our health outcomes. Infusing cultural competencies deep within educational veins, nurturing a new breed of professionals with an acute sensitivity to the social factors influencing wellness. African American voices, they deserve the megaphone. The influence they hold is key. It's their turn to steer conversations towards fair treatment in medical spaces. It's the empowerment that tips scales toward justice. It signifies dignity, self-determination, and everyone's undeniable right to co-pilot on their voyage through personal health landscapes. Breaking down the barriers of discrimination in healthcare for racial equity. Tearing down the formidable barriers rooted in discrimination within healthcare is an epic challenge, a journey that demands our combined determination and tireless dedication, alongside a robust set of strategies championing racial equity. The path to true equality is built on policies that put inclusivity front and center. We've got to make sure those insurance cards are more than just plastic in our wallets. They should be golden tickets, granting African Americans access to a world-class range of medical services, preventative care, mental health support, chronic disease management, you name it. Fund pouring into our healthcare infrastructure, non-negotiable. Picture this: hospitals and clinics flush with resources right where they're needed most, services expanded broader than ever before, state-of-the-art treatments within reach, and all without the gnawing fear or sting of prejudice. Representation is a game changer. Imagine more African American heroes in white coats, fearlessly tackling healthcare racism head-on. It's like looking into a mirror instead of through murky glass when you see doctors and nurses who look just like you. Healthcare pros shaking hands with local leaders. It's all about building those bridges made of trust and knowledge. Imagine what we could achieve together. A chorus rising up against medical bias demanding health equality loud and clear. This isn't just talk. These bonds are where magic brews, where discrimination crumbles under our feet as communities link arms to rewrite the narrative on racial disparities in medicine once and for all. Who's ready to roll up their sleeves with us? For ages, we've been relying on serum creatinine levels to gauge our kidney health, a total game changer in nipping kidney failure in the bud. But here's a shocker. Those go-to calculations for figuring out your glomerular filtration rate, GFR, that's your kidney's MVP stat, have had this nasty habit of sidelining African Americans. What gives, right? It turns out they pinned these numbers on an outdated hunch that African Americans are packing more muscle mass, which messes with serum creatinine readings. Talk about a sweeping statement. Not everyone fits in that box, and when their GFR gets tallied up wrong, well, talk about a healthcare headache, from missing a diagnosis to crying wolf over non-existent kidney woes. Let's get real. This is just one face of healthcare racism smacking us square between the eyes. Those harmless medical formulas, they're loaded dice tossing racial disparities into life and death stuff like who gets tagged at risk for dialysis or transplants. But hey, we're waking up. Med pros everywhere are rolling up their sleeves to tweak how we measure what matters inside us so no one takes the fall because some tests can't see past skin color. We're scouting new biomarkers and sharpening those equations till they cut straight through any medical bias trying to stick around. Getting this right, it's non-negotiable because nobody should be playing catch-up with something as critical as preventing full-blown renal meltdown, due all thanks, or no thanks, to discrimination in healthcare churning out wonky numbers. Imagine this. You're an African American faced with a kidney failure risk that's triple the rate of whites. This isn't some abstract concept. It's life or death. Tweaking how we gauge kidney function. That's critical for fair health care, making sure everyone gets accurate diagnoses and top-notch treatment for their specific needs. But recalibrating those medical formulas is only part of what we need to do. We've got to dig deeper, tackling broader issues like hypertension, diabetes, and uneven access to premium health care, all factors piling onto health inequality amongst African Americans. Let's get real about knocking down these barriers in our fight against racial disparities in medicine. Because when we roll up our sleeves together, wow, we're paving the way toward an era where your race doesn't predict your health outcomes anymore. Wrapping up this pressing concern of racism in medicine, it's crystal clear. The fallout is way more than just numbers. African Americans face deep-seated effects from healthcare racism and medical bias, forces that push forward health inequality and racial disparities like a freight train with no brakes. Think about it when we dive into the real-world punch discrimination delivers in healthcare to communities. Doesn't it become obvious? We need to band together. Systemic change isn't just important, it's essential for fair play when we talk about everyone's right to good health. Hey, you've seen how these issues weigh on our society, haven't you? Let me tell you, they're heavy burdens blackening countless lives due to unjust treatment within our very own healthcare system, where equality should be non-negotiable. It hits home hard. The fight against discrimination in healthcare must rise as an unstoppable force if true healing is what we're after for every single one of us.